Hello everyone, I'm Dr. Ng Hian Chan, consultant plastic surgeon from Penang Adventist Hospital. Tummy tuck surgery is part of the mummy makeover surgery where after women deliver babies, their skin have loose skin, stretch muscle, stretch marks. So tummy tuck surgery is to correct all those deformities. Ladies that deliver 2 or 3 babies or deliver twins babies where they have a lot of excessive skin over their lower abdomen, has stretch marks, bad stretch marks, or those have a scar because of cesarean section. Or the other thing is that if they deliver a big baby or twins baby, because of the big baby or stretching of the muscle will be stretched open. This is a condition we call a diastasis recti, where the rectus muscle is separated. So after the baby been delivered, so despite the baby is not there, but because the muscle is stretched open, so the lady will always look like 3 months pregnant, even they are not actually pregnant. So usually tummy tuck surgery is performed under general anesthesia, or it can be done under moderate sedation and tumescent local anesthesia. So the main part of the surgery usually is to remove a piece of loose skin, those excessive loose skin and fat from the lower abdomen. And after removing that, we will undermine the upper abdomen skin. And once we undermine, we can actually see the diastasis recti clearly, where we can repair the diastasis recti. So after we repair the diastasis recti, the muscle, we can actually do liposuction at the same time to create a curvature and lines of the lower abdomen. So the last part will be to create a new umbilicus. So usually ladies will prefer a small and sexy umbilicus. Then to ensure the safety of tummy tuck surgery, we need to make sure the closure is tension-free closure. Tummy tuck surgery usually takes about 2 weeks to 3 weeks to fully recover. So we need to really have time spared for this surgery. Usually patient will need about 1 night hospital admission. Most of the time, tummy tuck surgery will take about 4 to 5 hours, depends on the size of the patient. And after tummy tuck surgery, patient will need to wear a pressure garment for about 2 to 3 months, and they should refrain from lifting heavy weights and those activities that actually stretching the abdomen muscles. The result will last forever if you don't have another baby, of course, and you don't increase your weight don't increase for significantly, like 5 to 10 kilo. The result should be there. Yeah, and most of patients that come for tummy tuck surgery, they are very conscious about their body image, so they tend to take care of themselves very well. Yeah. You can do liposuction on abdomen, on your chest wall, on your arms, on your thighs. Yeah. So liposuction is just a procedure to remove the excessive fat using a liposuction cannula. But tummy tuck surgery is focused mainly on the abdomen areas. So for men or for single ladies who had no previous pregnancy, liposuction usually is enough. But if you had 2-3 babies, your skin is stretched and usually they got excessive loose skin. So liposuction alone is usually not enough, because after you liposuck all the fat, the skin will become even more loose and wrinkled. So that cannot be corrected with liposuction alone. So if the patient already had loose skin to start with, then most of the time they will need tummy tuck surgery instead of liposuction. And the other thing is, for those ladies that have a previous pregnancy, where the muscle of the rectus muscle is separated, then liposuction alone usually is not enough because they don't, it's not able to correct that. So you can see those ladies with diastasis recti, sometimes they are very thin, but their muscle can their muscle is separated, so when they relax, they always look like 2 months or 3 months pregnant. Yeah. So those sometimes thin ladies with a bulging abdomen due to diastasis recti, they will need tummy tuck surgery instead of liposuction. Yeah, after child delivery, yeah, most of the ladies still have a big uterus, and because of the hormonal changes, the body still have a lot of excessive fat, loose skin. So I would think it's not the best time to do a tummy tuck right after the childbirth or delivery, or right after cesarean section, because you won't be able to get a perfect result. So usually I would prefer to have wait for about 3 to 4 months for the effect of this childbirth or pregnancy over, and when the ladies had lost some weight back to their previous weight, then we can actually plan for a tummy tuck surgery for best and perfect result.